Okay, so for my last video for this integration with Ms. Sally Smith, I'm going to be performing my insulin administration. My patient is a 26-year-old. Her last AccuCheck was checked and it was 300. According to my doctor's orders, I'm going to be giving her 5 units of insulin. I've got my doctor's orders. I'm comparing it to my MAR, and I'm going to perform my 3 safety checks. So right now I'm at the Pyxis. So I'm going to go ahead and check my doctor's orders and my MAR against the medication in the drawer. I'm going to go ahead and pull it out of the drawer, and I'm going to check it once it's out of the drawer, and then I'm going to check it again at the bedside with the patient. So those are my 3 safety checks that I've performed. I've gotten regular insulin, and this is what I'm going to be administering to my patient per the doctor's orders. I'm going to make sure I perform my 10 medication administrations, making sure I've got the right route, right drug, right time, right patient, and right dose, which I do have. I'm going to have a second nurse come in. I'm going to turn it this way while I'm talking. I have to have a second nurse to witness the insulin with me. So I'm going to go ahead and do that. So I'm going to wash my hands, put on my gloves, and go ahead to proceed to start doing my insulin pulling up portion. So again, I've checked it against my MAR and my doctor's orders. I've got the right drug. I'm going to go ahead and assess the vial for consistency, see if there's any color, and the expiration date, which it is not expired. It doesn't expire until 2024, so we're good. I'm gonna go ahead and roll the vial in my hands. I'm not gonna shake it, just roll it in my hands. Once that's done, I can go ahead and sit it down, and I'm gonna take one of my alcohol wipes and clean off the top of the vial prior to me pulling up. Okay, once I've gotten that done, I know I'm gonna be pulling up 5 units. So I'm gonna go ahead, and I'm using an insulin syringe. I've got my regular insulin. I'm gonna go ahead and pull up 5 units of air. Perfect, okay. I'm gonna go ahead and remove the cap. And I'm going to push those 5 units of air into my vial, flip it upside down, and pull up 5 units of insulin. Once I've got that, I'm gonna go ahead and pull that off. I'm gonna go ahead and using the 1 cap method, 1 hand method, put the cap back on this. And at this point, I would have my second nurse come in and witness my insulin. She's gonna witness it, see that it's 5 units, and then I'm matching my doctor's orders with my right patient, and my MAR, and I can go ahead and give this to my patient. So I'm gonna go ahead and label it and mark it, and proceed to go to the patient's room where I would perform my last safety check. And here I would also do the remaining of my medication administration into the patient's room at the bedside. So I've introduced myself and performed my kiwis. Let her know that I'm going to be administering some insulin because her blood sugar was at 300. I would go ahead and give her some teaching on